Some of the major developments we're tracking: the known number of coronavirus cases worldwide now hovering at the 22 million mark, with close to 5.5 million right here in the U.S. and more than 170,000 American lives lost. With me here to start us off is ABC Chief Medical Correspondent Dr. Jen Ashton. And Jen, we know the coronavirus is staying with us, and we know that flu season is upon us. So a lot of people are wondering how they're going to tell the difference between the two.
And we're going to be hearing so much about this flu season, which generally starts in late September, October. But let's look at how they compare head to head if you put COVID-19 up against influenza. First of all, how contagious is it? COVID-19 much more contagious than flu. What about average incubation period? We've heard about 5 days being the average for coronavirus. COVID-19 flu is about 2. People are thought to be most infectious with COVID-19 48 hours before they develop symptoms, if they develop symptoms. With flu, it's actually after the symptoms start, so there's a difference there. And then the peak for symptoms with the two viruses, COVID-19 could be 2 to 3 weeks later. For the flu, it's generally right smack in the middle of that first week, 3 to 7 days. And again, Amy, caveat here, this is based on what we know now about COVID-19. Right. Could change as we learn more. That is
a fascinating comparison.
Yeah.
I was actually surprised by some of that. So what about symptoms, risks, and treatment? How do they compare?
Right. So when you look at that kind of second tier of comparison with COVID-19 versus flu, the hallmark difference so far seems to be really that loss of smell that you see with COVID-19. Again, not everyone, but a lot of people. With flu, you don't really see that. The symptoms are more stuffy nose, sore throat. There is a difference in fatality rate, and this bears repeating. People are calling them similar. Look at these numbers, Amy. They're not similar at all. The flu, 0.1%. That's 1 in 1,000. COVID-19, anywhere from twice that amount at 0.25% to 3%. There is a huge difference. Wow. And a huge range. Treatments, we've heard for flu, antivirals. COVID-19, there's not yet an FDA-approved treatment. They're all in clinical trials right now. And again, prevention, vaccine. We have a vaccine against influenza. We have many in development against COVID-19, but none yet.
Yeah, that was some eye-opening perspective there, Jen. Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.